Pulse Time platform is where we discuss the state of affairs of the nation and things that has been happening all around. Ground people that will come and talk about the state of the nation. So thank you so much. It is a beautiful morning in the city of Ibadan, Oyo State, Nigeria, and I'm saying a very warm welcome to you, and I really do appreciate you for tuning in into Immaculate Television. It's the platform again, and I'm here with lovely two guests. You know, the platform is where we discuss the state of affairs of the nation. That is what we discuss here, and some things that you think that you know, and some things that you think that you know that you really need to know more about it. And we are so concerned about our community, and one of our social
that made me glad until I think yesterday or day before yesterday I checked and there was 10 deaths, and then yesterday there was 4. But by and large, if you look at the number of new cases, we seem to be on a downward trend. But having said that, most of the time when you talk about public health and you talk about a new disease, you learn from other people's experience. You don't want to use yourself as an experience. So learning from what is happening in other countries who started ahead of us, you can see that the possibility of another spike is there if you don't take the right precautions. So definitely it's still out there.
Okay, if you're saying that it's still out there, my next question will be to you. Okay, a lot of people, you know, like maybe 2-3 months ago, people go out there to go and check the NCDC, and people started saying that it's like a sports online view, sports and everything like that, sports betting, like you just go and check the scores and everything, and people are not really taking it serious like it used to be. You know, the first week, I'm talking about January, February, people are so agitated, and we're looking forward to know that how is this pandemic affecting the Nigerian state. And we have the lockdown, we have the aftermath of the lockdown. People seem to have just forgotten if COVID-19 is still out there. What do you think might be the cause of that, sir?
Well, during the lockdown, if you know very well, a lot of people took it quite seriously, and then many people were not out there, but those who went out, who are out using outside, they have their guns on, their shield, their
face mask.
But after the lockdown was eased by the Presidential Task Force on COVID-19 and the NCDC, it seems that we have not been taking this quite seriously. And let me give you an example. I took a tour of a few states recently. I was in Edo, I was in Anambra, and I was also in Kaduna to see the level of compliance among our people. And we also have people who also went to other states. And the report we had was not good at all. People are not really taking it seriously, and it's even bad when you now see, when you now realize that those who are making the law are the ones breaking it now. If you go to government secretariats, government houses, they don't respect exactly what they said we should do. And I was in Edo State government house on Tuesday last week, and what I saw was not a good thing at all. I entered a lot of offices. I removed my shield. I removed my face mask, and I was expecting somebody to stop me from entering those offices. I was not stopped. In Kaduna, what I heard is that there's a task force that is in charge of compliance at the parks, and then anybody that is found guilty of not using face mask or shield, we have to pay 5,000. I made an inquiry and said, okay, since this is the 6th month that we have COVID-19 with us. How many offenders have you, punished with 5,000 or even less? And they couldn't even come up with 10 names, 10 people. And with my own observation, moving around the states, I saw a lot of people that are not wearing even in schools, even in secretariat and all that. So it's like, apart from our people not really taking it quite seriously, not complying with the safety protocols prescribed by government and NCDC, our government are not really, doing enough to ensure enforcement. I don't know why this is so.
Okay, so now what you said now is that there was no enforcement for the COVID-19 rules that has been put in place. So in a way, people are not taking it serious just because of that?
Yes. If there is a level of enforcement in any way, the compliance will be higher.
Okay.
If I spoke to a lot of people in government, and they also told me in plain truth that the level of compliance is low among their people, and a lot of government, also is doing something now. Thank God, also is coming up with something that will, ensure compliance. But how many states are doing the same thing? There are a lot of factors that I don't want to go into, but there are a lot of factors that
actually cause that.
Yes, that cause that.
Thank you so very much. Okay, ma'am, I'm here right now. Okay, I went to one of the town meeting we had the other day at Oyo State Secretariat, and it was an enlightenment for almost everybody there, because you really went deep and explained extensively. Now my point is this: I want to know, and I believe the public really wants to know, is COVID-19 going to stay with us? Like malaria, like typhoid fever, like any other kind of common cold and flu like that? And if yes, if COVID-19 is going to stay with us, why can't we just start living our normal life and learn how to live with it?
Well, I think it's plain obvious. It's going to be with us as long as we don't have a vaccine for it, as long as we don't have a cure for it. Viruses don't have cures, we just treat the symptoms. So it's a virus. And until we have a vaccine which is valid, and even when you have a vaccine, the fact that you take flu shots doesn't mean you don't come down with flu. So I think we should know that's a new normal. Everything, that's one of the new words that came when COVID-19 came, the new normal.
Okay.
But having said that, when you look at it, it's between the devil and the deep blue sea. On one hand, you look at public health. Do you want people to die? On the other hand, you look at the economy. I mean, just before we came in, Mr. Atoide and I were talking about how that has impacted even the media. If you are not involved in an industry, you don't know the impact, economic impact. It was one day that the light bulb came on, because I work with a federal employment, though I've not been paid because of ASU strike. I've not been paid. But having said that, I was told that people that work with private schools have not been paid salaries. They are not being paid salaries, and those are people, human beings that have children, human beings that have responsibility. So, when you look at the government, you think, oh, the government is being rash. But if you are not impacted, you might not even know how bad it is. So it's between public health and economy on one hand. So what I think we need to do is to cooperate with the government. Because like I said, I always say the more the number of people infected, the more the mortality will be. If you have 10 people die, 10 people infected, maybe one person will die. If you have 20, then it will be 2 people that will die. I mean, it might not be exactly like that statistically, but whether we like it or not, the higher the number. So what we need to do is to keep all the precautionary protocols in place. And talking about what you said and what Mr. Atoibi alluded to, I think we need to talk about this, that compliance, yes, but this is every time you talk about anything, you have to domesticate it. When you look at the Nigerian situation, when the federal government prescribed a lockdown, static lockdown, did it work? No, it didn't. And at that time, there were policemen outside. But just like he said, he alluded to it as well. Okay, they said you charge something, fine. And they couldn't bring out 10 people that have been fined. So what that tells me, if you are in Nigeria and you know what I'm talking about, is that people will be harassed, people will be extorted, and nothing will still come out of it. And I think that is why most governments, if you remember Ogun State, a woman was slapped, was harassed because of something over when there was a lockdown. She was going to go somewhere, or the person that was pregnant and was going to have a baby, and they were saying, no, you cannot go. So we know how things work in Nigeria. So this is just going to be another opportunity for people to extort and harass people. And I think that is why I know of the governor of Oyo State is reluctant to go that way. And that is why we did what we did the other time too. This is a new thing. This never happened before. And so what we need to educate ourselves that we should now be our brother's keeper. Like Mr. Toyebi said, if I see him not wearing a mask, when I came, what did I say? I said we should maintain some level of distancing.
Yes.
And that is being responsible, taking responsibility personally. Because if I come down now, like I always say, the scary aspect of COVID-19 is that until you have it, you don't know how it's going to behave. Whereas somebody that is much older than you will have it and then will shake it off, and then you have a 20-year-old that will die from it. So you cannot say anybody is safe or anybody is secure. So I think it's about being responsible right now. Compliance, enforcement, being our society, the society we live in. When you talk about enforcement, you have to tread cautiously, because you deal with something, you leave something else, and you start dealing with something else. And whether we like it or not, everything we do in Nigeria, we hold the government responsible. So even if you start having harassment again, the people will start crying again.
Yeah, exactly.
And say, oh, they're harassing us. They put out people out there to do this, to harass and harass us. So it's a delicate balancing act. And hence, that was why we did what we did, to actually have community engagement, to actually educate ourselves, and to let ourselves know that even if you think you are strong, you are not vulnerable. What about people that are around you? I always tell the story, which, I mean, when I had it, broke my heart. It still breaks my heart. Two parents in Lagos State, Nigeria, both doctors, frontline workers. We are fine, but they brought it home to their 21-year-old son who died. 21-year-old son that passed. So, and he had no previous medical condition.
Wow.
So that is the kind of disease we are talking about. So we all need to be responsible, to first cooperate with ourselves, and then cooperate with the government.
Oh, ma'am, you said something now that I really want us to actually, I want to get the real fact of it. You said that there was no underlying health issues. So it is even possible for you to be infected with COVID-19 without any underlying health issues, and that just like that.
I always talk about COVID-19 being an ongoing experiment. When it started, they said, oh, kids are not affected. It's not going to affect children. Until children started dying. They said, oh, if you are elderly from 60 and above, you are the vulnerable group, and then if you have any underlying condition like you are hypertensive, you have diabetes and all that. But now they find out that this 21-year-old that died, they didn't have any underlying condition. And now they are finding out that, younger people and elderly people, they have different reaction. Most of the time, what kills the younger people, according to medical doctors, I'm not a medical doctor, is that their immunity is very, very responsive. So it's the overreaction of their immunity that now is like an autoimmune condition that actually their lungs swells up and all that, and then they pass. But for the elderly people, their immunity is a bit compromised, so they succumb. So it's different ways of dying, but it's death all the same. And so nobody wants to die. I mean, we don't want to be part of the statistics. And I think that's what we have to remind ourselves. Do you want to be the statistics, or you want to be one of the people that will live to tell the story?
That is a question I'm going to take home to my family, definitely. So I'm going to come back to you now. She said something that actually went through my mind, and I was thinking, he said that if there were enforcement that were put in place, and we are saying that police should arrest people, or maybe they pay fine for not adhering to the rules that have been put in place by the government for this pandemic not to spread. Now my point is this, she said another thing. She said that might even be an avenue for some people to be harassing and extorting the public. In a way, how do we now go about this, apart from the fact that every individual should take responsibilities? Don't you think that there are some things? Now, take for instance, I'm going to talk about palliatives. Just like she rightly said, there are so many people that have been affected. Now, we're talking about compliance and enforcement. So many things have not been put in place. Some things like palliatives that are supposed to be distributed are not being distributed. People that are supposed to get some so amount of money are not getting the actual amount of money that they are supposed to get. You understand? So in a way, instead of me buying face masks of the breathable face masks that I'm supposed to use, I might think that, okay, maybe I should just use that 100 naira with me to buy one kungo of gari, instead of having the shield, the face mask, and every other thing like that. So how do governments come in to come and help the public to actually adhere to these rules?
Government has a role to play, and we, people in public places, we also have a role to play. to protect ourselves against COVID-19. Let me say this. If you think COVID-19 is not real, maybe you have to take a visit to the isolation centers across Nigeria. I have been able to see for things really in real time what is happening at our isolation centers. And like I always say, it's not a good news at all. I was in Olodo some times ago, and I was able to see some things. I said, well, those I spoke to, they told me that the youth population are taking things for granted, just like Professor Adeyemo said. If you think it's not really affecting the youth, by the time you see the number of youth, children that have died from COVID-19, probably you can take it seriously. So we have a role to play among we the people. We don't have to wait for government to enforce, protocols that has to do with our whole lives. Because if a government official is coming out to tell you to do things that will safeguard your life, and you are not doing it, if something happens to you, will you blame government? You'll be able to blame government at this level. I mean, at this time. So we people living, going to public places. You should know what to do. There are guidelines. There are things to do, and they are very simple. Like you said, instead of buying a face mask for 100 naira, some people say, why should I buy it for 100 naira? I would rather buy Gary. Well, that's another thing. Poverty among our people is also another factor. But that is not saying that we cannot do things that will save that will guard our life. You can afford not to go out, you don't have things to do outside. You can stay at home. The stay at home is not just for the lockdown. Okay. It continues because COVID-19 is with us. Either we like it or not. If there is no vaccine, like Professor Adeyemo said, if there is no vaccine and there are no drugs for the treatment, we have to live with it. We have to live with COVID-19 until there is a way out. It's going to be like malaria, like Lassa fever, like any other ailment, any diseases you have known. So we have to prepare to live with it. And the only way, if you don't want Lassa fever, they will say, guard your food against rats coming in and all these things. Our people are taking to that. What is stopping our people from using the appropriate prescription that they have given us? Use face mask aside. It's just 100 naira. And let's also not forget one thing. Much as COVID-19 has brought, a lot of economic hardship on our people, it has also created jobs, a lot of jobs.
Okay. Thank you so very much, Mr. Femi Atoyebi. I'm just going to go for this quick commercial break, then I'll be right back with more questions. I know our time is fast spent. Please.
COVID-19 dey really e dey close and e dey dangerous, no be lie. Now we collective responsibility to dey protect we self, family, the weak, plus include all the elderly people them. My people, you must to dey careful. Even self, whether you think you say you dey strong, no forget say you get somebody wey dey at risk. Pastors, imam, say una dey follow all the guidelines of social distancing for una congregations. Our market people, plus include bus drivers, taxi drivers, okada rider, abina marwa. Wetin una dey do to protect yourself with your fellow citizens? Banking, school, and business owners. Now your responsibility to protect public space. Make coronavirus vamusu. Remember, say COVID-19 dey take spread when people wey don't get them they talky, cough, sneezy, abi you can't get contact with contaminated surface them. Oyo State government don't set up a statewide decontamination network to arrest the spread of the virus and to protect the people of Oyo State. Our governor, His Excellency Engineer Seyi Makinde, they salute you now for your support and commitment to keep Oyo State safe and prosperous.
You're welcome back. It's still the platform on Immaculate Television, and I still have my guest here with me, Professor Adeyemo, and so also Mr. Femi Atoyebi, and I've been discussing about COVID-19 today, and there has been a lot of things that has been discussed, but because my time is very much fast spent, I'm just going to go for this question, ma'am. Okay, it's like this. Maybe February, April, March, we have a very high rate of, we have COVID-19, 10,000 people. Sometimes you have 12,000 people in a day that the NDDC will put forth that, okay, these are the numbers of people that have been tested, and these are the people that tested positive to COVID-19. Now, people were adhering to the rules then. They were locked down. We were in lockdown. People are not going out. People are not actually socially interacting like they used to. Now, the lockdown have been eased. Then we have people not adhering to the rules. We have people not using face masks, face shield. Then you go to the market, you see people touching each other. You see the traffic, how people are, touching each other, jamming each other. Even sometimes people will sneeze on you.
We are recording maybe 10, 15. So there's something there which we will know by and by, because this is an ongoing experiment, like I said. But don't ever forget the position of underreporting. We are underreporting. Number one, culturally. People are, because of the stigma, because of, I don't want to be isolated. So many people, I know somebody personally that I know that had it, the husband had it, but they never went to the hospital. They just stayed home and did all the, everybody knows what the drugs you need to use. And so most people just self-medicate out. So we are very much underreporting. The other thing is that culturally, when people die, how many people do we? People die and we don't talk about it. And then most of the time we just allude to, I'm well on. If it's a Muslim, by evening they bury the person. So we cannot, take away the position of underreporting. And whether you like it or not, we are becoming like a it's like, everybody was so afraid when we started, but now people are easing off. So there's a lot of things that is going on that we don't know about. But the fact that COVID-19 is with us, like Yoruba people will say, so we shouldn't be a statistics. That's all. That I think that is the most instructive thing that we can say. Don't wait until you become one of the statistics.
Okay. Thank you so very much. That you are going to give us your last word because our time is fast spent.
Well, my last word is that Oyo State is doing a lot.
Okay.
When it comes to containment, Oyo State has its tentacle all over Oyo State to do containment, advocacy, and all that. That's what Oyo State is trying to do, to engage with citizens, to appeal to their sense of responsibility. And that's what Oyo State is doing to do that. And I would say we should cooperate with the government to do the right thing. Like you said, if somebody dies now, of course the governor will extend his sympathy, but it's not going to affect him personally. If somebody dies, it's your wife, it's your children that will be affected. If a woman dies, it's the children that will be impacted. So think about those people when you act.
Thank you so very much, sir. Your last word.
The enemy, NCDC, PTF, that's the President Task Force on COVID-19, Ministry of Health, they have warned us, despite the respite we're having in the past few days, that we are beginning to have, the curve is beginning to flatten out, that it's not a hoo-hoo yet. We are not there yet. We still have it among us. So probably our testing capacities have not really up to what we have in developed parts of the world. But as the Prof just said, don't wait until you become one of the cases.
Oh, thank you so very much, Mr. Femi Atoyebi, and thank you so very much, Professor Adeyemo Oladike. It's very lovely for you to join us this morning to discuss about this pandemic that is still eating deep into the society. And a lot of questions are here, I tell you, and there are so many subsequent questions that I really want to ask because my time is fast spent. I'm still going to call them back. I believe they are going to answer me because that is part of their social responsibility. Okay, I'm going to part away with this word that I heard today from Professor Adeyemo Oladike. She said, do you want to be part of the statistics or part of the generations that we tell the story? My name is Miriam Moni. Thank you so very much for joining us today.
ọ̀rọ̀ àjàkálẹ̀ àrùn covid-19 yìí kì í máa ṣèrọ̀ ó súnmọ́ wa pẹ́kípẹ́kí ó sì léwu gidigidi ojúṣe rẹ ni láti dáàbò bora rẹ ẹbí rẹ àtàwọn arúgbó àtàwọn ìkókó tó wà láwùjọ wa bí ò tiẹ̀ mọ̀ ẹni tó lè mú tí ó kàn kọ́ àìsàn covid-19 yìí ń gbilẹ̀ nígbà tẹni tó bá ti lùgbàdì àìsàn bá ń sọ̀rọ̀ wúkọ́ tàbí sín láwùjọ tàbí tó fi ọwọ́ kan ohun èlò tọ́pọ̀lọpọ̀ èèyàn ó tún lò gbogbo olórí ẹ̀sìn ǹjẹ́ ń bọ̀wọ̀ fún ìlànà kátàkétí rẹ̀ nílé ìjọsìn yín ìṣọ̀wọ́ kátàkárà ọlọ́kọ̀ èrò àti tàdánù ọlọ́kadà àti kẹ̀kẹ́ ẹlẹ́sẹ̀ mẹ́ta arọ̀ yín láti dáàbò bo ara yín àtàwọn tó wà lágbègbè yín ẹ̀yin ilé ìfowópamọ́ ilé ẹ̀kọ́ àti ilé ìtajà àgbàlódé láti dẹ́yẹ sáìsàn kòrónà yìí ìjọba ìpínlẹ̀ Ọ̀yọ́ ti gbé ìgbìmọ̀ tí ó pinwọ́ ìtànkálẹ̀ àrùn covid-19 kalẹ̀ ó sì máa wọ́jà rẹ̀ kárí gbogbo ìjọba ìbílẹ̀ rẹ̀ ẹ jọ̀wọ́ arọ̀ yín láti tẹ̀lé àwọn ìlànà ìmọ́tótó àyíká yín gómìnà ìpínlẹ̀ Ọ̀yọ́ onímọ̀ ẹ̀rọ Ṣèyí Mákindé ló sọ pé ẹ ṣé púpọ̀ fún ìfọwọ́sowọ́pọ̀ yín láti mú kí ìpínlẹ̀ Ọ̀yọ́ ní ètò ààbò àti ìrọ̀rùn tó péye.
In case you're just joining us for the first time, platform is where we discuss the state of affairs of the nation and things that has been happening on the ground.
Ground people that will come and talk about the state of the nation. So thank you so very much.